Hey everybody, today we're talking about my philosophy of what I stitch versus what I'm going to glue and what I'm going to tape. In general, I'm always thinking of these three things. What's the infection risk? How's it going to look? And how's it going to work? In general, our infection risks are really low. I want to think of how long it's been since this wound was opened. If it's more than 12 hours, I am far less likely to close it. Or if I am going to close it, I might leave a lot of space between the stitches so that there's still a way for an infection to get out, and I'm likely going to put them on antibiotics. The next thing I'm going to look at is how's it going to work? How much tension is it going to be under? Something on the forehead or the cheek or the back versus right over the elbow. Well, we know that it's going to move more over the elbow, and therefore it's more likely going to need stitches. And the final thing is cosmesis. I've talked to plastic surgeons in general, and they say, you know what, if it's less than the width of your pinky nail or pinky finger, it's less likely to leave a scar. Now, I'm still keeping in mind if it's on the face or not. When I'm looking at, let's say for example though, common one, kids on the chin here, if I can't see the wound when I'm looking directly at their face and it's on the underside, I'm going to consider taping it first. Now, if I'm going about taping, this is how I do it. Or if I'm having that conversation with someone or their parents, this is what I'm going to say. Look, why don't you let me put the tape on? We're going to look at it together. If it comes together nicely, then I'm going to add glue on the edges of the tape to help it stay in place. And then what I'll do is I'll put something on either side of the skin for the cut that will help the tape stick. I believe it's called Cavalon, but we have a skin prep here. I let it dry for 30 seconds, then I'll put the piece of tape on or two, and we'll look at it together, myself and the patient or myself and the parents. And if it looks good, that's it. I'm not doing stitches just for the sake of stitches. The next thing I want you to know is that if we can do a removable stitch, especially for kids, we should be doing that and really asking ourselves, do we need to stitch in the first place? Thanks, everybody.